What's up, guys? Welcome back to Jane's Lane. In today's video, I'm coming at you with 5 hacks for documenting like a pro. So I'm sure we all know the importance of documentation. It allows for better treatment, better care. It allows for everyone to be on the same page, continuity of care. It safeguards the patient, but it also safeguards you as the nurse. Documentation in a patient's chart, it is a legal document. So you need to keep this in mind. Whenever you sit down to write anything down, you need to remember that this is a legal document. If you didn't chart it, it didn't happen. If you did an assessment and you said, okay, patient's respirations are regular, but you didn't chart it, you never did that assessment. So it's important to cover your butt and always, always, always document. Hack number 1, chart as you go. Do not leave your charting for the end of the shift. I have fallen victim to thinking that I could chart at the end of my shift. I was extremely delusional. I've talked to many nurses who have done the same thing. You know, you're having a crazy 12 hours, everything is going wrong, and you feel like you don't have time to sit down and chart. So you tell yourself you're gonna sit down and chart at the end of the shift, but Murphy's Law, whatever can go wrong will go wrong. So of course, before end of shift, you have an IV that's come out. You have a missing medication. You have patient's family that wants to talk to you because they're upset and they're demanding that the doctor come and see the patient now. All of these things are on the go. You don't have time to sit down and chart as you thought you would. So what happens? You're stuck charting at the end of your shift, and it just sucks. Staying late to chart sucks. So avoid it and chart as you go. When you do an assessment, take a minute and write that down. When you give a medication, take a minute and write that down. It's going to save you so much time, and it's just going to make your life so much easier and increase your chances of getting out on time. And guys, when you have had a hard shift, the longest 12 hours ever, I can't even explain that feeling of clocking out and going home. So chart as you go. Tip number 2, avoid abbreviations. Write out the full word. For example, if you want to write patient, write out patient. Do not write PT, because PT can be interpreted as PT time, you know, when we're looking at clotting factors, or PT can be interpreted as physiotherapist. To avoid any misinterpretations, just write out the full word. Avoid using I. Do not chart using first person. Don't do it. Avoid any slang. Although you want your documentation to be genuine in the sense that it's you know, you are the one that's writing it, it's authentic, you don't want it to be like you're in a group chat with your friends. Don't use any slang. Keep it as professional as you can. Avoid using any curse words, any expletives. I've never included any expletives in my documentation unless it's a direct quote from a patient, and that's usually a situation where a patient was agitated or verbally abusive. I will include that and say that this is what the patient said to me to paint that picture. But outside of that, never use curse words or expletives. Tip number 3, do not chart in future tense. Guys, when I first started nursing, I ended every single note with will continue to monitor. And I thought I was the baddest nurse on the block, you know, a little sprinkle at the end of my note, will continue to monitor. But no, you never want to chart in future tense, because that allows opportunity for misinterpretation and for you to be placed in the hot seat. So I'll give you an example. Let's say you charted something like this medication was given, will follow up to evaluate the effectiveness of this drug. Let's say you did follow up with Mr. Smith. Mr. Smith's pain was a 7 out of 10 before you gave him his pain med. You followed up and now he's saying it's a 3 out of 10. I feel so much better. I can actually get out of bed. You know, I feel more relaxed. That was great. Great, you're happy to hear that. You don't get a chance to chart it and you move on with your day. But because it's healthcare and nursing, something goes wrong, there's some type of adverse event specifically related to this drug. So then they're gonna come and question you. They're gonna say, you know, Jane, you gave this drug, based on your charting, you said that you were gonna follow up and evaluate the effectiveness of the drug. Did you follow up? And even if you say, actually, yes, I did, and Mr. Smith said X, Y, and Z, if you didn't chart it, it didn't happen. So now you're in the hot seat and you have nothing to safeguard yourself because you didn't chart it. So instead of charting in the future tense, I will evaluate or I will follow up. Do your assessment, follow up, and then chart it. You know, med was given at this time, patient expressed relief, verbalized that he's feeling better, pain is now 4 out of 10, is able to get out of bed. So if you're going to be following up, let's say for the effectiveness of a drug, do it. Follow up, do your assessments, but make sure you chart it. Make sure you chart it to cover your butt. Hack number 4, keep it short and sweet. This is something I really struggled with when I was a new nurse. I thought that I had to write down everything. I thought I had to include every single thing, but really, the name of the game is keeping it short and sweet. Keep it thorough, but to the point. And guys, just put yourself in someone else's shoes. So let's say you call the doctor, I noticed this, or my patient is having leg pain, and you are charting like your life depended on it, just going and going and going like the Energizer Bunny. The doctor reading that, yes, they're gonna read that because that is their job, but it's like, who wants to read 3 pages of documentation for a patient that's having pain in their left leg when you could have just put it in 1 paragraph? And for my new nurses, fear not, this is a skill that will come the more you work as a nurse, the more you do it, the more comfortable you will become. It'll get easier, but you should be keeping that in mind when you sit down to chart. I'm only including pertinent information. I'm keeping it short and sweet. Not only is it easier for the person that's going to be reading it, it's easier for you. It saves so much time. You can get in, get out, do your documentation, and you're on to the next. So keep it short and sweet. Keep it thorough, but to the point. And guys, this last hack is a little bit specific, but I used to do it all the time as well until somebody put me on game and I was like, I'm never doing that again. And I will make sure to scream this from the rooftops and tell all my fellow nurses, you shouldn't be charting patient is asleep. Why shouldn't you chart patient is asleep? Because it just leaves room for so much error. So I'm gonna give you an example. You charted patient is asleep, but then something happens and the patient passes away in their sleep. They're gonna pull up the chart, they're gonna see your documentation, and they're gonna say, well, Jane, the patient passed in their sleep, but you documented that patient was asleep. How do you know that the patient hadn't died already? And even if you went in, you felt Mr. Smith's pulse, you saw that Mr. Smith was breathing, you didn't chart it. So remember I said, if you didn't chart it, it didn't happen. So now you are in the hot seat and you're left to kind of prove yourself, and there's nothing to protect you. There's nothing to safeguard you. So instead of writing patient is asleep, you can write patient is resting in bed with their eyes closed, regular respirations with rise and fall of chest noted. The regular respirations with rise and fall of chest noted is the golden piece here, because that tells whoever is reading it that the patient is in fact breathing, that the patient is in fact alive. So let's rewind. Mr. Smith did end up passing in their sleep, but they pull up the documentation and they see that Jane had charted that there were regular respirations, meaning that he was breathing at this time. So, we can eliminate that he had expired at this time. You're safe, you have covered your butt, and it's all because you did not chart that the patient was asleep. So let's go from the top, you guys. Tip number 1, chart as you go. Number 2, avoid using slang. Avoid charting in first person. Avoid using any expletives or curse words. Tip number 3, avoid charting in future tense. Only chart in past or present. Tip number 4, keep it short and sweet. Thorough but to the point. That is the name of the game. Thorough but to the point. And number 5, never chart that patient is asleep. And there you have it, guys. Those are my 5 hacks for documenting like a pro. But I want to see what you have to say. Do you have any tips or tricks when documenting? Or do you have any mistakes that you made when you were documented that you feel comfortable sharing so other nurses can learn from this? Please drop a comment down below. I would love to read it. And as always, please like and subscribe for more content like this. Thank you so much for watching, and I will see you in the next video.